my name's Joyce Gibb, and thank you so much for being with me today. I've recently, first of all, the season for shingles is fall, winter, most of the time. And nobody really knows what causes shingles. There is some insistence that maybe it was a high-stress time of your life, and whether it's, divorce, financial, going through school. But typically, shingles appears when there's an upregulation of the herpes zoster. Okay, there's 3 kinds of herpes: lip, vaginal, and the last one is body-wide, and that's herpes zoster. If someone has already had chickenpox, which is the chickenpox virus, that's what this actually is, then you have more of an precipitants to get shingles in your lifetime. So what about shingles? What can we do about that? First of all, it has to, if it's caught early, it's very, very treatable with Valtrex or acyclovir. And it's precipitated typically by pain. Shingles is only one side of your body, so if you have rashes on both sides of your body, unless you're immunosuppressed, like I saw one of my patients one time several years ago, actually had shingles on both sides of his body when he had HIV, and that was diagnosed in the office. So, but that rarely happens. The main hallmark of shingles, it's one side of your body. And so we look at nerve dermatomes, which are the nerve roots from your spine, and they innervate certain parts of your body. So just let me give you an example. L4 and L5 is from your spine. It goes down your leg, down the outside of your tibia, like that's the top of your leg, and then to the outside of your foot. That's L4 and L5. So, but most people can get shingles on these places. You can get them in your scalp, and all once your scalp's tingling, your scalp's burning, and even up to a week before this can happen, and then all once it looks like you have poison ivy on your scalp. Now, to me, I really feel like shingles looks like poison ivy many times. So a lot of people can relate to that. But, shingles actually has little vesicles or fluid-filled lesions that can appear after the rash appears, okay? The longer you wait, the more little vesicles are going to appear, the harder it's going to be to treat. So if once that rash appears, if you're and it's burny, tingly, you need to get the doctor see a medical professional then, because the sooner you treat it within 1 to 2 days, the less likelihood that's going to spread, which means the virus stops shedding when you take the antiviral drugs. And it's typically 7 to 10 days that you're treated with the antiviral drugs. So sooner rather than later. I don't think there's, any study that says if you give it later, it's not going to harm the person. That may continue to keep the virus from shedding further. And I've seen people in urgent cares when I work that they came way too late. And that the significance of limiting the spread of shingles is it can give lifelong pain. Lifelong pain is not good. So what do I typically do? I always treat somebody with a prescription first. And then after that is over, I put people on, there's a couple things. We have something called Veracor. And I use this for people that get like little, herpes on their lips with sun exposure, et cetera, in the summer. And they take it every day, and it suppresses, that outbreak from coming up with the sun exposure. But I put people on this for a month or 2 afterwards, and it's 2 once a day. It has vitamin A and zinc. All these things heal surface linings, and it helps suppress the virus from spreading. So that's one thing. The next thing is that if it does progress where you have, it's called neuropathic pain from the shingles, we do have a compounding pharmacy in our office, and if you're in the Pittsburgh area or want to come even from out of state, we can actually give you a cream because this can be lifelong pain, and it can be in your scalp, and it can be, on your nose. If you get shingles on your nose, that's more specific. That needs seen right away, because if it's on your nose, that dermatome goes to your eye. So the one I've seen people have shingles around their eye, and then we have to have them see an ophthalmologist immediately just to make sure, if their eye's not involved, because, that's, you don't ever want to go blind because of shingles. So, and it can affect your eyesight. So the sooner the better that you can get treated with shingles. And this is the holiday season coming up, or any holiday season, any stressful time of the year can bring out shingles. And a lot of older people get it. You can get women or men underneath their breast tissue, on their back. They might have a little area here. And I've had people say, well, about a week ago, I started having this pain right here. And then it broke out a week later, or it can be a couple days later too. So if it's an odd place that you're getting, that pain, and you don't typically have pain there, watch for it. Have somebody else, if you can't see it, look at your back. I know my mom, after my dad passed away, my mom had dementia. She got a little spot on her back, and then it actually went down her leg too. But it was on the same side of the body. That's the same dermatome. And we got her treated, and soon enough, and she was fine. But there is help for people that have neuropathic pain. So give me a call. I'd love to. You stop in the office and you're in Pittsburgh area, I'd like to look at it too to see if I think it's shingles. If you want an opinion, I'd be glad to do that too. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.